All right, got it. Yes. All right. So we're going to talk about what I see in the clinic first, working with Duke Orthopedics, and then we'll talk about what I experienced in the sports setting, and then we'll open it up for discussion. Okay. So starting with lack of access. A lot of times when patients come to us, you know, it's already hard enough for some people that are new to the country, whether it be in Spanish, whether it be in any other language, it's hard enough for them to get an appointment. Then they get there and, they can't check in because everything's in English, or, the front desk folks don't have, the interpreter iPads handy. So having resources in their language as soon as they check in is really a problem. I'll put on here, it's very easy for us to just open up your iPhone, get on Google Translate. I highly recommend that's the last resort. Let's see, does this work? There we go. Found this thing about Google Translate in Australia for you guys. Little dad joke. But in especially in the hospital world, all the terminology is difficult to understand, let alone even in English. I mean, we have people that only speak English that still don't understand what they're signing, still don't understand what they're reading. So you add that in a different language, and it just gets amplified. So what options do we offer? And also, anybody feel free to stop me and shut me up if you have questions. Okay. So we have me, but I'm not supposed to translate quotation marks there because I don't have whatever licensure Duke requires. So we have these tablets, right? You can either call in or you can do a video call, and the quality and the consistency of the interpreter tablets is just, it can be great and they can be terrible. Sometimes you get on a call and the person that you're on the call with sounds like they speak better English than they do Spanish. It's just it can be very inconsistent. Another thing to note, some providers, some doctors will say, oh, well, the dad's daughter is in the room, or the mother's son is in the room, or whatever, their cousins in the room, they can translate. And I want to advise using that as your main source of interpreter service, just because some 8-year-old that speaks English pretty well is in the room doesn't mean that they're going to be able to convey whatever the doctor is saying to that patient in the right way, or accurately. And then also, the last bullet point I have, sometimes interpreters are so focused on translating exactly word for word that they don't go to the level of the patient, whether it's going higher or lower, depending on what they understand, on what their education level might be. So sometimes, somebody starts translating and in the language that the patient speaks in, and they still don't have a clue what they said. A little story, we had a patient that speaks Mandarin, and her husband was in the room, and her husband works for Duke and speaks English, and she got upset with him and said, no, I need the tablet because you're not translating correctly. And we were all like, oh, wow, that's kind of interesting. So that does happen, and I'm glad that she did that, because most people wouldn't speak up like that. All right, next slide. Lack of education, and this goes both ways, both from the healthcare and from the patient. Clinicians don't know a lot of the times what the patient that's coming in, they don't know their background, they don't know their history, they don't know how they got to this point in their life where they need to see a doctor. So, you know, they're just the next patient, you know, and that's just the truth, sad truth sometimes. And then from a patient side, you know, a lot of patients, you know, just even in English, the process of getting an appointment, the process of what happens after an appointment, reading your after visit summary, things like that, that can be complicated no matter who you are. I mean, insurance in itself can be a nightmare. Understanding insurance, co-pays, billing. You know, nobody knows what an explanation of benefits is half the time. When patients ask, well, how much is this going to cost? And you tell the patient, well, it's going to be in your explanation of benefits. And they're like, what's that? So things like that patients don't understand themselves is difficult. And, you know, like I said, if it's difficult in English, it's going to be harder in any other language, you know, trying to translate that. All right, next slide. And another thing that I see a lot is lack of empathy, lack of motivation from the healthcare side. And this we see this all the way from, you know, whoever's checking in a patient all the way to the surgeon. And mainly I think it's because a lot of it has to do with reimbursement. Hospitals are driven by getting paid. Any Wu-Tang fans out there with cash rules everything around me will understand. So, you know, it's we see the eye roll. Medicaid patient comes in that can't afford their copay. You see the eye rolls, and you know, then you add the fact that this patient, you know, doesn't speak English, and now you have to go get a translator, and you have to get the interpreter, and it's just things like that. Just that, you know, not every provider unfortunately has the motivation and the empathy to take care of that patient. So, you know, you get some trauma that with insurance would have reimbursed the hospital, you know, what, like in ankle trauma, 140 grand. And now they're going to get 0% of that. So it's just things like that can have an impact on patient care, unfortunately. And, you know, not everybody sees patients as people. Sometimes they see them as dollar signs, and that's just, you know, a sad truth, but it can happen. And language barriers have a lot to do with that. Let's see. And also, unfortunately, you know, sometimes a difficult topic to discuss is discrimination. It happens. It's just another sad truth. And, you know, sometimes providers, they don't know that they're discriminating, and you know, that's the whole naive versus ignorance. You don't know, or you don't want to know. You know, patients come in and you know, sometimes you see some front desk staff just they don't want to help. They don't want to take the time to help. And whether they're doing it on purpose or not, you know, you never know, but it happens. And then, you know, we have patients that I've seen a provider, Kelly might know who it is, who refuses to get interpreter services, who refuses to get somebody that speaks the same language that they do, and says, I don't need to speak their language. I'll just do an eval. I'll see it with my hands and with my eyes, and that's enough. And so, and you know, unfortunately, there's that patient will not have any advocacy for their health during their visit, and is just, it happens. If it's happening in where I work, it probably happens in other places too, right? A lot of times, you know, especially for undocumented immigrants or for recently documented immigrants, they don't want to see a doctor. They don't want to go to the hospital. You know, they're scared that they might get deported. They're scared that ICE is waiting for them. You know, there's all these fears, and I've seen it, I've heard it, that, you know, if they use their real names, if they use their, you know, the people that have the temporary identification number before they get their social security, the TIN number, they don't want to hand that out. because they're afraid, what if they lose their green card? If or some patients that may have insurance through their work, if it's like, construction, landscaping, whatever, something like that, they'd rather self-pay because they're scared of their documentation status if they're in the process of that. So, now you have patients paying $250 just to be seen by a doctor, which actually just increased to $300 just to be seen by a doctor, and adding to bills, adding to costs. So yeah, there's a lot of fear of getting through the front door. Being afraid to go to the doctor, that just is another huge barrier in getting good healthcare. So I kind of made this little thing of a vicious cycle, the lack of access, lack of education, lack of empathy and discrimination that will delay healthcare in one way or another. And then health of the patient is going to get worse as a condition worsens. It gets more expensive to treat. As it gets more expensive to treat, providers want to treat it less, and it just creates more distrust. It creates, patients want to go to the doctor less. And another thing that I failed to mention, sometimes patients don't speak English, but they understand it. And this happens all the time where, patient is not comfortable speaking English. And so the provider just assumes that they can say whatever they want in English. And of course they understand everything they said. Or they'll go on the hallway and they'll be like, do you see this guy? Blah, 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 talking about a patient and in English because they think they can't hear it, and they hear it and they understand it. So it's just things that, we see a lot, unfortunately. All right, more towards the audience here. In application in sports, this is very similar, but instead of having providers and nurses and doctors, you have coaches and administrators. And people watch TV. If it happens in the NFL and major leagues and women's soccer and in the Olympics, it's setting bad examples for college and high schools, and coaches watch this, kids watch this. So I worked in baseball for a while, and I saw big leaguers getting discriminated based on language, and with really good coaches. And probably, whether the coach was doing it on purpose or not, obviously, impossible to tell. But the point being is, if it's happening at the highest level of sports, it's happening everywhere else. And a lot of time, even little things, little micro things like English speaking coach doing after practice work with an English speaking player. Maybe that a Spanish or whatever other language player doesn't know how to reach out to this coach, doesn't know how to get extra time after practice, after a game or whatever. And so you see that a lot. You see preferential treatment for English speaking players in baseball all the time, unfortunately. I think nowadays, I think the Major League Players Association has rules in place where you have to have translators. So hopefully things are getting better, but back in 2014, 15, 16, it was not like that at all. And just a lot of things that coaches don't take into account is just the day-to-day struggles that international athletes have to deal with. Even one of my coaches, he's from Venezuela, told me the story when he first made it to the United States out of the Dominican Republic, in the Dominican Summer League. He didn't know how to. He was starving because he didn't know how to order food. There's little things like that where we take for granted. But your foreign athletes, your exchange student athletes, that just walking to the front of the line at Wendy's can be impossible. Can anxiety, just all you can do is point to the screen and hope that whoever the cashier behind the desk is can understand them. So little things like that happens a lot. I worked with a lot of mainly the athletes from the Dominican Republic, and you see it a lot is they all they get is takeout. You see that all the time because they can do that through an app on their phone, and they don't need to speak English for it. And so instead of making meals like some of the English speaking players and American players, coming out of college, that have the ability to go to the grocery store and make something healthy. A lot of the international athletes are just, getting something through an app, probably junk food. Definitely see a lot of nutritional differences there. So what was I going to say? Yeah, and from coaches, a lot of coaches just don't know that kids that don't speak English need help. It's like, well, this kid never comes up to me. This kid never asks for help. This kid, never asks for time after work, or time after practice. And and some coaches are quick to, think that they're, I don't know, lazy or whatever, because they're not asking for extra stuff. And it's just sometimes they just don't know, or they're embarrassed, or they're scared. They might get made fun of or whatever. So there's just a lot of things that goes into that. Just being from a different country and trying to speak to somebody with authority is just intimidating, no matter the setting. If you don't speak the language and you're speaking to somebody with authority, it's just instantly intimidating. So just having some awareness in your setting. First thing, don't assume that players don't need treatment, or help in the training room because they don't communicate. Just like with coaches, players might be hurt, or might be going through some injury, and they just can't tell you, or they don't know how to tell you, or they're embarrassed to tell you. If they get pushed back and eye rolls from other figures of authority, they probably think, well, the athletic trainer is going to do the same thing. But I put CYA on there because I've seen it before in the professional setting where a player won a lawsuit because they weren't getting treatment. And of course the team was like, well, they didn't say anything. It's like, well, because you didn't have the resources available for that player to speak up. This happens more with like Korean, Japanese players. That's the one I saw with a Korean player in baseball that went to litigation because he wasn't getting the appropriate care. But everybody just assumed that he was, but he didn't have a translator all the time with him. So preparing yourself in the training room, preparing yourself in whatever environment that you work in. Just something super simple like these Spanish to English sheets from Amazon. Like, there you go, boom. These things. When I worked in baseball, everybody had one of these in their drawer. Whether it was a coach, or it was an athletic trainer, or it was an assistant, a video guy, everybody had these on hand. There was a pile of them. You could grab it. They were free. Everybody, the team just paid for them. They're really handy if just want to communicate something simple with an athlete. There's some really good apps out there. The good ones cost money, unfortunately. But there's some really good apps that just take what you say, boom, translate it, and I've seen patients use them, I've seen athletes use them, and I know there's a lot of bad ones out there too, but there's some really good translating apps that you can invest in. Another thing is education. Always educate your coaches, your directors, your teachers, that hey, this player doesn't know how to reach out to you. Hey, this kid that's always on the sidelines, he just doesn't know how to talk to you, coach. He just needs some one-on-one. And sometimes coaches will never know that until you tell them that. And just bringing in bilingual people into the picture can be huge. Even can the Spanish teacher come out and help? Little things like that. With when I worked with the baseball team, we had an English teacher, because all the Spanish players got English classes, and the English teacher, I used her all the time. When I didn't feel comfortable translating something, I was like, hey, can you come help me translate this, whether it was something in written or document, or just like face to face, where she was really good with all the little nuances and differences in like South America, just like little slang things. She was really good with that. I brought her on all the time to help me translate things. Can parents help out? Sometimes you might have bilingual students that aren't student athletes, but can they help out? Things like that. So that's all I got, Kelly.